Today we will discuss about Lemierre syndrome. First, what is Lemierre syndrome? Lemierre syndrome refers to infectious thrombophlebitis of internal jugular vein. It most often develops as a complication of a bacterial sore throat infection in young, otherwise healthy adults. The thrombophlebitis is a serious condition and may lead to further systemic complications such as septic emboli. Lemierre syndrome occurs most often when a bacterial throat infection progresses to the formation of peritonsillar abscess. Deep in the abscess, anaerobic bacteria can flourish. When the abscess wall ruptures internally, the drainage-carrying bacteria seeps through the soft tissues and infect the nearby structures. Spread of infection to nearby internal jugular vein provides a gateway for the spread of bacteria through the bloodstream. The inflammation surrounding the vein and compression of the vein may lead to blood clot formation. Pieces of potentially infected clot can break off and travel through the right heart into the lungs as emboli, blocking branches of the pulmonary artery that carry blood with a little oxygen from the right side of the heart to the lungs. Sepsis following a throat infection was discovered by Hugo Scott Muller in 1918. However, it was André Lemierre in 1936 who published a series of 20 cases where throat infection were followed by identified anaerobic sepsis of whom better understand this syndrome. These are the definition of terms. Pathophysiology of Lemierre syndrome. Lemierre syndrome begins with an infection of the head and neck region. Usually, this infection is a pharyngitis, but can also be initiated by infection of the ear, mastoid bone, sinuses, and salivary glands. During the primary infection, Fusobacterium necrophorum colonizes the infection site and the infection spread to the parapharyngeal space. The bacteria then invade the peritonsillar blood vessels where they can spread to the internal jugular vein. In this vein, the bacteria can cause the formation of a thrombus containing this bacteria. Furthermore, the internal jugular vein becomes inflamed. These septic thrombophlebitis can give rise to septic microemboli that disseminate to other parts of the body where they can form abscesses and septic infection. The first capillaries that the emboli encounter where they can nestle themselves are the pulmonary capillaries. As a consequence, frequently involved the most frequently involved site of septic metastasis are the lungs, followed by the joints, which are the knees, hip, sternoclavicular joint, shoulder, and elbow. In the lungs, the bacteria cause abscesses, nodulary, and cavitary lesion. Pleural effusion is most often present. Other sites involved in septic metastasis and abscess formation are the muscle of the soft tissues, which are spleen, liver, kidneys, and nervous system. Production of bacterial toxins such as liposaccharide leads to secretion of cytokines, the white blood cells, which then both lead to symptoms of a sepsis. Fusobacterium necrophorum produces hemagglutinin which causes platelet aggregation that can lead to diffuse intravascular coagulation and thrombocytopenia. Etiology of Lemierre syndrome. Lemierre syndrome is currently rare, but was more common in the early 20th century before the discovery of penicillin. 19 cases in 1997 and 34 cases in 1999 was reported in the United Kingdom. The incidence rate is currently at 0.8 cases per million in the general population, leading it to be termed as forgotten disease. The mortality rate was 90% prior to antibiotic therapy, but now it is generally quoted as 15%. Cases reported mortality was as low as 6.4%. These are the signs and symptoms of Lemierre syndrome. First is swelling in your neck, shooting pain down into your neck, and tonsillitis. Severe headache, coughing of blood, photophobia, fever, trouble swallowing, lethargy, hardness of breathing. Diagnostic workup of Lemierre syndrome. Lemierre syndrome is usually diagnosed after you show certain symptoms for an extended amount of time, especially a sore throat, but several lab tests can diagnose this syndrome, including CRP test or C-reactive protein test. C-reactive protein test is a blood test that measures inflammation in your body, together with ESR test or erythrocyte sedimentation rate test, which also measures inflammation in your body. If either of these tests suggest that you may have a bacterial infection, your doctor may then use imaging tests to look more closely at your throat and neck. Some imaging tests your doctor may use include CT scan or computer tomography scan. It allows your doctors to look at a cross-section of the area where the infection is located. Is the ultrasound test. And let your doctor look at the possible blood clots around your jugular vein. Lastly is the X-ray. It can help your doctor find any symptoms or complication of the syndrome inside your body. Finally, for the treatment of Lemierre syndrome. First is the antibiotics. Clindamycin, metronidazole, beta-lactam antibiotics such as amoxicillin. Doctor may use other antibiotics if you have another bacterial infection caused by staph or other bacteria. Next approach is surgical approach, which is ligation, and if not, anticoagulation therapy is administered, which use Coumadin or clopidogrel or Plavix. Concludes my discussion of Lemierre syndrome. Thank you for watching.